This is 17 News with continuing coronavirus coverage.
Good morning from the 17 Newsroom. I'm Alex Fisher. It is 10 a.m. on this Thursday, and we are awaiting a news conference from public health officials who are going to give us an update on the latest numbers on the coronavirus crisis here in Kern County. As you know, more than 1,000 people have tested positive across Kern County. Most of those people, though, have recovered at this time. About 60% of those who have been infected in Kern County have recovered. And this has been a defining moment, a defining week for us as we learn more about the coronavirus in Kern County, because on Monday, you may remember, public health officials released new information in regards to where these cases were being confirmed in Kern County, and especially breaking it down by zip code. Right now, public health officials have not released new numbers quite yet. We're still waiting for them to release that information. It usually comes down about 10 a.m. It looks like they're just lagging just a little bit today. But again, we are supposed to hear from public health officials this morning on the coronavirus crisis here in Kern County. We're also supposed to hear more about the plan on reopening Kern County. As you know, Governor Gavin Newsom is set to announce his steps and his protocols on opening the government, or opening the state, into phase 2. He says this is not going to be like a light switch, if you will. It's going to be more of a phasing into this next phase, if you will. That could take several days, if not weeks. Now, it can also be different from county to county, or even more specific from region to region. So we will keep you updated on that. We're going to stream his news conference live this morning at 10 a.m. right here on TV 17, as well as our KGET Facebook page. So you'll be able to watch his news conference coming up today at noon. Again, it's supposed to be, he's supposed to lay out the plan and talk a little bit more about what phase 2 will look like as it goes into effect as early as tomorrow. So that, again, is coming later today on 17 News at noon. But once again, right now, we are breaking into programming, trying to give you an update on the coronavirus crisis here in Kern County. This is Public Health Director Matt Constantine. Let's listen in.
Interpreters Alexandra and Stephanie, so thank you both for, again, being here with us this morning. Today, I am pleased to announce that we have Dr. Lyon, Christopher Lyon. He is our health officer, and Ryan Alsop, the chief administrative officer, who's here today. We are changing things up a little bit, primarily because information is changing very rapidly. This is no longer a public health department issue. This is a county-wide issue, and it affects all of us. So we are changing up kind of how we're presenting this and who is participating, and in particular also because of the governor's roadmap, his roadmap to reopening, and especially as the state moves into stage 2. So those reasons are dictating how we kind of are adapting on the fly. This morning we are announcing that there are 2 new deaths, unfortunately, that we're reporting this morning, and we have 60 new cases this morning. Now, on the governor's plan to reopen his roadmap, he's listed out 4 stages. And those stages are, stage 1 is safety and preparedness. That's technically where we are today. Stage 2 is to address lower risk workplaces, which the governor has indicated we will move together as a state on Friday. And this allows us to address lower risk sectors and to adapt those workplaces so that we can reopen under some modifications. Stage 3 is higher risk workplaces, and this is again designed so that we can adapt and modify those workplace settings so that we can open up in stage 3. And then finally, stage 4 is the end of the stay-at-home order, where we can expand the workforce to the highest risk areas. On Monday, the governor mentioned we are moving into stage 2. He now has identified phases within stage 2. We will be entering phase 1 of stage 2 on Friday. And he has provided some information that we will be able to open up some retail businesses for curbside or delivery only. He's made mention of bookstores, clothing stores, flower shops, sporting goods stores. He has indicated that other types of businesses will be later in stage 2. Offices, dine-in restaurants, shopping malls. So those are specifically identified as not being in phase 1, but somewhere down the road in stage 2. And we are awaiting further guidance. We are hopeful that today we will get some guidance, and then tomorrow at his press conference we will. We will also. The governor has also made mention that we can put together a readiness and containment plan that will allow us to expedite the county's travel through stage 2. Ryan will talk about this county-wide process in a few minutes, but we're hopeful this will allow us to quickly go through those phases faster than the state government. We know that this is confusing, and as the governor releases these additional facilities that can open, there'll be questions. We stand by to answer any of those questions. If you call Kern County Public Health, 661-321-3000, we will be happy to try to help you through this process. I also want to talk about testing. We are expanding our testing capabilities in Kern County. This is important for us as a county so that we can identify those that potentially have the disease that may be asymptomatic, and that we can then take some actions to help isolate those individuals at home so that we can stymie the further spread of this disease. We have 4 what I'm calling state-sponsored sites that are online. One at the Mojave Veterans Hall, which opened up on Tuesday. They operate Tuesday through Saturday, 7 a.m. to 7 p.m. We have the one at the Bakersfield Fairgrounds that opened up also on Tuesday. And they're operating Tuesday through Saturday, 7 a.m. to 7 p.m. We have the Oildale Veteran Building that we hope to be open up on Friday. I don't have yet the hours established. And we have the East Bakersfield Prato Senior Center that opened up on Monday. This is a drive-through clinic, and it operates Sunday through Thursday, 8 a.m. to 2 p.m., with the exception of Mother's Day this coming weekend. This coming Monday, they'll be closing at 11 a.m. The qualifications for testing, the primary focus are those at risk, those that are symptomatic, those that are essential workers or have other underlying health conditions, but it's done at no cost. The county on Tuesday also tasked the CAO's office and public health with the establishment of some additional county-sponsored testing sites. We are attempting to stand up sites in Delano, Taft, the Kern River Valley, and Lamont or Arvin. The sites are still being developed, but the point of this is there's no cost to the public, there is no qualifications, all are welcome. All of this testing information will be on the county's website. There is a specific button for testing, and that'll be updated as soon as we have all of the information solidified. There's also been some discussion, some clarification on the pending test category on the county's, on Public Health's website. I want to just take a few minutes to try to explain that. There are a number of pending tests on that testing category, and that pending test is made up of test results we're waiting to hear from. So anytime a doctor suspects that you might have COVID and they test you, they are required by law to send in to Public Health that suspect case. Now, anytime that suspect case is positive, that result is then sent to Public Health as required by law, and we then indicate it on our website. For those that test negative, there is no legal requirement for a lab or a doctor's office to provide us notification. So that pending category includes negative test results that we have not yet received, and it also includes likely some positive results that we have not yet received. The far majority in that category are made up of those tests that are likely negative, but we actually then take the extra effort to reach out to every lab or every doctor's office and get clarification, is this a negative result? So we are actually reporting those negative results. We expect, as more testing occurs, that pending category will go up. We do have a rather unusual commitment from all of our 10 acute care hospitals that they are going to start to report their negative test results to us to help expedite that process. I also want to talk a few minutes about the Kingston Healthcare Center at 329 Real Road. We've talked about this before. This is a skilled nursing facility that has approximately 140 residents. This is a state-regulated site. It is not regulated by the county. And the California Department of Public Health is reporting and has reported that there are 35 COVID-positive healthcare workers and 35 COVID-positive residents. That is concerning to us. Kingston reached out to the county for help about 10 days ago with staffing. Their staffing numbers were not adequate, so they reached out to the county for help. We have scrambled and we have found staff that will assist, and we then have gone to the state and asked the state for help. Last Saturday night, the state sent in a medical assistant team that was made up of 28 medical staff that are now helping to staff the skilled nursing facility. Yesterday, Kingston again asked for help, and the state is deploying 7 additional medical staff members. They arrived last night that will also help to stand up this facility. We're going to continue to monitor it. We're going to ensure that that the facility is successful and the proper care is given. But this is a state-regulated site, and it is Kingston's obligation and the state's the ability to provide resources that's important, but we'll continue to monitor. Also, there were some questions about restaurants opening up in the last few days. We want to make clear that the governor's order remains and that restaurants should remain closed to dine-in services. We are continuing to reinforce the state's order. We continue to provide communication. Our stance, public health stance on this issue has not changed. We've been doing awareness and education so that our local restaurants know what is the right thing to do. We will continue to do that. The governor's order is still enforceable by law enforcement and by the state, and the state's paying attention. So it's important for us to remember that that order remains and that restaurants should continue to abide by that stay-at-home order. With that, I'm going to introduce Dr. Christopher Lyon. He is our health officer for a discussion on a couple items.
Good morning. Thank you for joining us virtually today. I appreciate you continuing to help us practice our social distancing. We have been working as a county diligently to prepare and respond to the rapidly changing pandemic. In response to the state indicating that reopening would commence imminently, I rescinded the health officer order so that we would be positioned to allow our community to safely start reopening as soon as allowed by the state. However, while the local order has been rescinded, the governor's statewide stay-at-home order is still in effect. We appreciate the community in their response to the stay-at-home order, and I ask that you continue to maintain social distancing practices and good hand hygiene to help control the pandemic. There have been a number of questions about antibody testing And at this point, there is so much more information we don't know about antibody testing than we know. There are more and more tests coming online, but we don't have data to know their accuracy or what they mean. Even if they detect antibodies, we don't know if these antibodies will confer immunity, meaning that you cannot get the disease again, or how long that will last. So we would urge caution in the use of these antibodies for any major decision making. Thank you, and we highly encourage you to continue your awareness and safe social distancing.
Thanks for that, Dr. Lyon. It's a pleasure to be here this morning, joining both Dr. Lyon and the Public Health Director, Matt Constantine. I also want to point out in the room, you can't see them, but our fire chief and battalion chief who are in charge of the county's Emergency Operations Center, which continues to be active at full capacity with a pretty good effort and great team at the EOC, who is really kind of the cornerstone for the county in this endeavor that we're in to battle COVID, whether it's the continuity of communication and information across the county, continuity of planning. They're doing a great job, and so I want to say thank you to our EOC staff, and particularly to our fire chief, along with Brandon. Thank you very much for all of your work. I want to clarify something, and I want to be very, very clear and very, very specific. Matt alluded to it. Dr. Lyon alluded to it. The state of California, Governor Gavin Newsom, is calling the shots on this pandemic. He is calling the shots on the stay-at-home order. He is calling the shots on the limited business activity order that he has given. He's calling the shots on how the state and how cities and how counties will reopen. It doesn't matter where you are in this state. It doesn't matter what city you're in. It doesn't matter if you're a charter county or a city or a general law city or county. It doesn't matter. The state is in charge. The orders by the governor are law. And I think it's important for people to understand that. We don't have to like it. We can protest it. We can argue about it. We can advocate for greater flexibility and latitude in how we make decisions locally, which we're doing. The board is doing that. But at the end of the day, it's the state. So any business that is getting out in front of Governor Gavin Newsom's orders, which have the force of law in the state of California, are doing so at their own risk. Let me just be clear, because there's lots of questions about enforcement. I want to tell you that in Kern County, we're fairly clear that we don't want to go out and arrest folks and provide big fines to folks locally who are simply trying to get their businesses back open and get back to work and provide for their families. We're not interested in going out and being punitive, overly punitive in this environment. We understand what they're going through, and we are trying to be thoughtful. Let me be clear on what we're doing. We have continued to communicate with local industry over the last many weeks. Our focus and our goal going forward, our objective is clear. We are going to continue to reinforce what the state is telling us to do. Reinforce the orders of the governor. We are reinforcing his transition plans to reopen the economy. There are several stages. Matt talked about them. We are going to continue to reinforce those. If we have to do it 10 times, we will do it 10 times. We've continued to reinforce those rules with the restaurants that have opened recently. We feel your pain. Again, if you are getting out in front of the governor, you are doing so at your own risk. I guarantee you, I've worked in the governor's office, not in this administration, in a previous administration. They are paying attention. They are paying attention, and there are a plethora of regulatory strings that the state has available that they can utilize. They're paying attention, if you're a restaurant, you've got the ABC. If you're in cosmetology, you're licensed through the state. There are a number of different jobs and industries who are licensed through the state, and you need to be aware. So I just wanted to make that as clear as possible. We don't have to like the directives. We can protest the directives. We can ask the governor for, again, greater flexibility and latitude within those directives to accelerate how we open and when we open, and we're doing that. But we, again, just ask businesses to be aware of the situation, to have clarity on it, and to make smart decisions, and to really help the county. We're currently asking for greater latitude and flexibility on how we do this, and your actions may be providing greater headwind to getting to that point with the state. Please, thank you for your patience. We want to open the economy more than anybody, and that's what we're planning on doing. There are many businesses that fall into sort of a gray area of the governor's order. We are trying to open currently as many of those businesses as we can under local public health guidelines. It's there where we have the greatest flexibility. We're utilizing that flexibility. We're trying to get as many of those businesses open as possible. I heard today coming in here the announcement of 33 million people unemployed in the last 7 weeks. That's a quarter of this nation's workforce. These are extraordinary times, and we're going to be paying for this for a long time. And I ask for everybody's patience and support. There is no playbook on this for the county. We're trying to make the smartest decisions that we can. We're trying to do it in the most safe and responsible manner. And I, again, thank you and continue to ask for your support. Our Board of Supervisors has formed an ad hoc committee. That ad hoc committee is made up of 2 of our board members. They obviously have a great deal of support from county staff, and they are engaging with industries throughout Kern County. They're doing so to ensure that those industries are aware of the current status of their industry within the guidelines and directives of the governor. We want to make sure that we are working with them now to prepare for reopening, because we are anticipating accelerating through the stages of the governor's transition. We want to make sure that we get best practices in place for them so that once the governor says you can open, they're ready to open, no problem. We want to hear their needs and challenges. We want to make sure that the Board of Supervisors is doing everything possible in terms of policy that they could be implementing to get people open and back to work as quickly as possible. Those industry calls and discussions are happening. We'll be on a call, in fact, this afternoon with restaurants. And we're going to continue doing that over the next many weeks as we anticipate a move through the governor's transition phase to get businesses open again. On Tuesday, the board sent a letter to Governor Newsom simply asking this: Kern County wants greater latitude in making the decisions on reopening. The governor has spoken about a pathway to an accelerated opening schedule. He's spoken about regional variances throughout the state. Not all counties are the same. Data points are different. Geography is different. Populations are different. Hospitalization rates, et cetera, are different. The state, as Mr. Constantine pointed out earlier, the state will be providing some official guidelines to our county, hopefully later today, that will outline a protocol for a readiness and containment plan that then the state will use to determine whether or not Kern County can receive greater latitude to accelerate through this reopening. We are awaiting those guidelines. When we get them, we're going to be working with public health, our EOC, and across the county to get that plan together. We will likely be holding a special meeting of the Board of Supervisors as early as next week, Monday, could be Tuesday, so that they can hear this plan, and we will be getting that out to the state because we want to get open. Again, final guidance is forthcoming based on a number of data points, and we will keep you updated. I want to tell everybody, you can go outside. You don't have to be in your homes. Please go out. Our county parks are open. We're asking you to use your head. Limit your exposure to transmission of viral infection. Don't have a party out in the park. You can take family members and go ride your bike. The governor released a list of things that you can do outside about 4 days ago. I looked at it. My only criticism is it's weirdly unique and specific. It talks about BMX racing and quad biking, and you can play badminton. I haven't seen anybody play badminton for about the last year. You can play ping pong. There are a number of things. Let me tell our residents, if you want to go out and shoot hoops with your son or your daughter or by yourself, go ahead and do that. Again, use your head. Practice social distancing. Keep your hands clean. Don't touch your face. If you're sick, stay away from people. It's real simple. So go enjoy the outdoors. County parks continue to be open, and we're glad that they are. We would just ask that you continue to utilize the guidelines that we have provided. I want to talk quickly about county budget issues. I continue to get comments or questions about how the county's faring financially. We just heard this morning that the state is anticipating a projected $54 billion with a B dollar deficit, and next year about an 18% unemployment rate up and down the state on average. I can tell you that based on what I'm seeing, I think Kern County is at least at 18%, if not more, currently. And our county's initial projections on revenue loss, probably over the next 2 fiscal years combined, is between $40 and $50 million. This is due specifically to the response to COVID. It is in large measure due to the precipitous drop in the price of oil recently, and it will also be affected by the actions taken by the state to address their $54 billion deficit. Their May revise is due out next week. We'll see what that says, but the state passes through a great deal of funding to Kern County, just like other counties, and that is going to have some effect. Things can change, folks. There are decisions that could be made. There are the economy. It depends on what the economy does. The federal government's debating a stimulus package for local governments. There are things in play and some unknowns that could change the situation, but right now, those are the numbers. We will be addressing those in our regular budgeting process, which is ongoing now, working with our departments. We'll be doing it smartly and prudently, and saying some prayers as we do it, because it's going to be difficult. I would finally just say our homeless shelter, I'm getting questions. I'm going to take an opportunity right now to say the M Street Navigation Center is built. The equipment has been moved in. The staff has been moved in, and we will likely be accepting our first client next week, probably toward the end of next week. We are going to start with clients who are currently out at the fairgrounds, who are in our temporary isolation units. These are folks who are being isolated due to COVID-19. Once they are cleared to be moved, we have a relationship with them now. We will move them into the navigation center. We will provide wraparound services for them and try to get them on a pathway to sustainability. Those will be our first clients. It will be a measured, slow buildup and practice, but next week it will start, and obviously this will all be informed by the current environment that we're in with the pandemic, with the appropriate protocols and safety in place, etc. And lastly, I'm going to ask all members of the media for your help as we go forward. This is a very complex, very fast-moving, very confusing time for a lot of folks. Folks get their information from all of you, and so I want to just put it out that clarity and precision with regard to what it is we're doing here, the information that we're being put out. I would just ask, and I'm not saying you don't do a good job already. You do a good job. I'm asking for the continued support as we move forward in the county. It's going to be important, and if you have any questions, if you're not clear on anything, call Matt directly. You can call me directly. If I don't have the answer, I will put you in touch with somebody that does, just to make sure that we're getting the most accurate information out in a timely way. So I will end it there and be happy to answer any questions.
So, to our local media, this is a time you can hit *6, and we have a designated order today where we have a full house. You are each allowed to ask a question in the order that we have designated, and we are ready for your first question.
All right. Can I ask the first question?
Sure.
Hi, this is Elizabeth with Kern News. I'm just wondering, it seems all week county officials have really been emphasizing, the governor's stay-at-home order is still in place. So I'm not sure if there was confusion among residents, but because it's been so emphasized, has there been an increase in businesses not in compliance with the stay-at-home orders, or why is this being emphasized so much?
I'll invite Ryan Alsop.
Hi, ma'am. I don't know if we have a good answer to that question. I mean, I'm only reading what I read from the media. I read about Mossman's. I read about Moo Creamery. I saw on TV another eating establishment. We believe that the approach that we've taken on this, which is a communications-based approach, we're reinforcing the state's orders. We believe that's worked quite well. Those on the essential business list continue to operate. That list is evolving as the governor makes decisions. There's clearly people on who are listed under the non-essential, for the most part, we are. I think we're happy with the responses that we've seen from businesses. What I'm saying is that as I read things that are being reported by the media about these various restaurants, my advice to them is the governor's staff's reading that stuff. He's paying attention. And again, they have the regulatory ability to do a variety of different enforcement actions. They don't have to send the National Guard in. They don't have to send the CHP in. There are licensing tethers. There are permits. There are a whole slew of things. So you need to be aware of that. And again, if you have questions about any of that, businesses are directed to call our Department of Public Health.
Thank you.
Next question.
Can I ask the question?
Yes.
Okay. So one of the main concerns we have been hearing from our community is that many landlords and restaurants, for restaurants and renters, are pushing forth eviction notices prior to the governor's May 31st safety period that was laid out. So how is the county going to protect these home renters and these business renters when they essentially still have these obligations to pay forth their rent? And is this considered illegal, essentially? Do you, if my, tenant is trying to evict me earlier and May 31st is coming up, and considering the county is taking this into their own hands, is the county considering extending that deadline and maybe making it easier for these people to transition during this uncertain time?
I am going to invite Mr. Alsop up to address that.
Hi, ma'am. I didn't hear what organization or media outlet that you're with, but I'm not sure what you meant by the I'm not sure what you meant by the county taking it into their own hands. If you could clarify what you meant by that.
Yeah, so at the beginning of this press conference, the Director of Public Health was announcing that you guys are essentially shifting the way that you guys are navigating this situation in terms of the state obligations and the county's obligations. And by essentially rescinding the order, this is no longer entirely a state, or entirely, right? It's the state situation. Weren't you guys talking about how you were shifting the plan?
No. Let me be clear, and I want to move away from the county's order. That was rescinded Saturday. And we are moving on. It's over. We are. Today is Thursday. Let me be clear. The state of California is in charge. The state of California, Governor Gavin Newsom, his orders have the force of law, no matter where you are in the state of California. They are calling the shots. So the county. I'm not sure again what you mean by the counties taking it in their own hands. Essentially. Pardon me?
Essentially, the enforcement angle of it is essentially what I'm asking.
Okay, and so what's your specific question on that?
So you're saying if the state is the one calling the shots, you guys have spelled out that you guys are going to continue to enforce the guidelines.
We are reinforcing the guidelines. Reinforcing the guidelines.
Okay, so essentially, how do these people? So do I report this to police if this is happening to me? That's my question.
If what is happening to you?
If someone's trying to evict me.
Oh, okay. So getting to your point, I'm sorry. So yes, your initial point. I don't have a good answer. I will seek to put together a good answer for you, ma'am, and I will get that to you. We will look into that. I mean, what I can tell you is we are holding an industry call with restaurants today, this afternoon. I will, if this is an issue, I'm sure it will come up and be discussed. If it's not brought up, I will bring it up as a courtesy to you. I do not have a good answer on that. I have not heard that is an issue, but I believe you, and we will work to provide you with an answer on that if that suffices.
All right, and then will that be guidance, more so guidance, or will you just continue to make it seem as if this is an enforceable action based off of how we're going to move forward?
I'm not sure that I have a good answer to that question at this point. I haven't heard that is an issue, and we'll look into it.
Uttering what I hear in the community, just letting you know.
Okay, yeah, let those people in the community that are talking to you, tell them to call me, and that would be the most expedient way for us to help them. Thank you.
And we're ready for the next question.
I have a question. This is Tim from Channel 29. So obviously today at noon, the governor is going to be having his press conference laying out some of the new guidelines and regulations for the start of phase 2 reopening tomorrow. Now, are we expecting there to be any kind of transition period where these retailers that are going to be allowed to reopen, they're going to have to implement certain changes? Will a lot of these shops actually open tomorrow, or is that something that's going to push it back to maybe Saturday, Sunday, Monday? What are we thinking about that?
Tim, I'm going to let Mr. Constantine address that.
Thank you.
Thank you, Tim. These are timely questions and very important. The governor has said that those limited number of types of facilities could reopen as early as Friday with modifications. And then he's mentioned curbside and delivery. Beyond those statements, we are awaiting further direction, and we have little further detail.
Okay.
Thank you.
We're ready for the next question.
Hi there, Ryan, Matt, Michelle. This is Kern from 17 News. I understand you've been saying that the governor's order, it is managed at the state level. They have complete control. But thinking locally about law enforcement, Sheriff Youngblood was just quoted saying that his department and other local cops will not be citing or arresting restaurant owners or business owners who violate the governor's order. How will then this be enforced? Will this be enforced at the local level, or is this more just like a statewide overseeing?
Hi, Karen. I'm going to let Mr. Alsop address that.
Sure thing.
Hey, what's going on, Karen? I'm going to try to answer your question here. Again, the county is in a reinforcement mode. That means that we are doing our level best. In actuality, we're going to extraordinary lengths to reinforce the rules that have been laid down by Governor Gavin Newsom through his executive orders as it pertains to which businesses can operate and as it pertains to his stay-at-home order, which both have the force of law. We are continuing, if we get a complaint or if we read in the paper or see on, for instance, KGET, a report about a restaurant that we didn't know about, our public health officials will call and reinforce and communicate to them that it is not time for them to be opening, that this is the current situation that the governor has laid out, to answer questions and to let them know, to the extent that they get out in front of the governor, they're doing so at their own risk. And again, I'm making the point that the state has plenty, especially as it concerns restaurants, it has plenty of ability to utilize regulatory actions against any business that it wants. Certainly restaurants. Most restaurants have alcoholic beverage control licenses. That's a tether that the state has and some control. And I do know for a fact that the alcohol beverage control has already been communicating with local businesses in Kern County about just that. So I hope that answers your question, Karen, and I'm happy to have any follow-up with you.
Yeah. It's just to clarify, it seems that on the county level, you're taking more of an education and communication approach over an arrest or fine. Would that be fair to say?
That would be fair to say. Yes, ma'am.
Thank you.
We're ready for our next question.
I'll go if no one wants to go.
All right. Good morning.
Public
Good morning,
health going
Michelle.
to be appointed.
Can you hear me?
Can I go?
Yes, we're ready.
Since we've hired a lawyer and a statistician, you all have changed your policy on information that you're providing to the public. Fresno just announced that their ninth deceased was an 89-year-old from a nursing home. Now that we have the lawyer and the statistician, is there any intent to change your policy on our deceased? Will we get more information on their pre-existing conditions, age, etc.? And by the way, let me thank all three men for attending this morning's press briefing.
Of course. I'm going to bring Mr. Constantine up.
Thank you. Yes. So we have released significantly more information, as you indicated, by hiring a statistician to evaluate our local numbers and our ability to release more information. So on Monday, we released cases and those that have recovered by zip code on the map. We have released ethnicity data and sex data on the website. So we still have a little bit more work to do. If you'll notice, there are some, in the ethnicity categories, there are some unassigned or blank in the ethnicity category. So we're actively still working at clarifying that. We're actually calling the doctor's office to determine the ethnicity of those that tested positive. So we have a little bit more work to do on that. But to answer your question specifically about further information about death data, that's certainly something we could consider as we as we evolve through this, I know there might be additional information that we want to consider. So we could certainly review that and look at other options. What else could we potentially release?
And a follow-up, is it accurate to say that in terms of opening, that decision will come through Dr. Lyon and not through you, Mr. Constantine?
The decision is a joint decision at the county level between county council and public health. Together, along with the Board of Supervisors, we can evaluate what additional options there are. Hopefully that answers your question.
Thank you.
And we're ready for the next question.
So this is, yeah, I have another question. This is Tori.
Well, has everyone, let me first clarify that everyone who's on the call has been able to ask a question that has not yet asked it.
Okay.
I'll have all the media on the line been able to ask their question. Okay, this will be our last question, and I'm ready for you.
Yeah, so what was interesting, follow-up to a reporter's question from Ryan Olstep, essentially the way that unfolded was at the end of it, we heard that businesses weren't going to be arrested or fined. So this sounds more like a slap on the wrist. And if that's the case, how do you guys really intend to push forth the message that you guys are taking it seriously based off what the governor's saying if these people are just getting slapped on the wrist? How are we really going to maintain accountability in our community if these people are not going to be arrested or fined? As a business owner, what incentive, like there's no incentive for me to stay closed if I'm not going to be arrested or fined. So the accountability to enforce these methods sounds like there's some more questions that need to be answered there. If that's how you guys are moving forward now, but I'm just trying to understand if you guys are pushing forth this message, why and so hard and asking people to, basically go at your own risk, how are we going to continue to slow the spread if there's no accountability and incentive to comply?
Well, you're assuming that there's no accountability and that you're also, let me be real clear. I think I've addressed this a couple of times. Let me be very clear. We're not slapping wrists. We're not doing any slapping. We are reinforcing in an extraordinary way to industries across Kern what the governor's orders are. Depending on what industry you're in or what business that you're in, you may fall in an essential business. Let me tell you, most businesses are in the essential category. There are a handful as compared to the essential category. In the non-essential, we need to get those businesses open, but you can bet we're communicating with those non-essential businesses what the guidelines are, what the rules are. If you're in an essential category, there are guidelines for you there too, and we're making sure that people understand what those guidelines are. Again, we're opening where we can as many businesses that fall into the gray area. We have some authority there under public health guidelines. But we are communicating with businesses throughout the county. We believe that it has worked well. We believe that's something that will continue to work well. We will continue to reinforce that the governor is calling the shots. And when I say that they're operating at their own risk, again, I'm saying that the state is paying attention. The state has the regulatory ability across many sectors of our economy, many different industries, many different businesses, to take regulatory action against businesses that get too far out ahead of where they are in the transition plan to reopen. And I'm not sure I can say it any more clearly than that. Thank you.
Thank you.
Michelle, could I ask one more question of Dr. Lyon?
That we are concluding the press conference for today, and we just want to thank all of our media for your. Okay, we're going to let one more question. We're ready for you. Mr. Bailey, do you want to hit star 6?
I was going to ask Dr. Lyons about convalescence plasma and whether it's being used on former patients or if it's being used on current ICU patients, and does he encourage former patients to go to Houchin and provide their plasma and perhaps become a donor of their antibodies?
Thank you for that question. I think that's a great question as we start learning more and more about some of the different possible treatments. At this point, I'm not aware of any specific individual patients that are being given convalescent plasma in our community. We have had some start of dialogue with Houchin about trying to facilitate the collection of convalescent plasma, and we will definitely continue working on other treatment options as they come about.
Thank you.
Are there any other follow-up questions from the media? Well, with that, we're going to conclude today's press conference. Thanks to all of you for tuning in, and we encourage you to stay safe. Thank you.
And you've just been listening to a news conference from public health officials. It was one of the longer ones that we've heard since the pandemic started, about 50 minutes or so. We heard from Matt Constantine, the Director of Public Health. We also heard from County Chief Administrative Officer Ryan Alsop, who talked about the local order that was rescinded, and talking about and addressing local businesses who have reopened for dine-in. He says that the governor is watching and says that there still could be implications that come from the state level when it comes to the stay-at-home order. As you know, coming up in about an hour and 10 minutes, we're set to hear from Governor Gavin Newsom, who is set to give us an update on the state's next phase in reopening. That is called Phase 2, and it allows some businesses to reopen with some modifications. So again, he is supposed to be laying out that plan coming up in about an hour and 10 minutes. As you know, there is a ton of information that can be found on our website, kget.com. You can go there for the latest on the coronavirus crisis here in Kern County. We'll see you back here today for 17 News at noon.